Okay, so next 4 stations are all about your skill. Station 4, not 4, Station 5th, 6th, 7th and 8, ये चारों भी आपको क्लिनिकल स्किल रहेगा. क्लिनिकल स्किल मीन्स जो भी हम लोग डे टू डे नर्सिंग लाइफ में हम लोग जो क्लिनिकल skills करते हैं फॉर पेशेंट, लाइक ग्लूकोज मॉनिटरिंग, गिविंग स्टीम nebulization to the patient or giving inhaled medication to the patient, dressing, wound dressing and all. This all includes in the skills. So first of all I will tell you all, total there are 15 skills, but out of this 15 you will get only 4 skills to perform for your OSCE exam. So you have to be very much careful about all the 15 skills because you don't know which skill you will get for your exam. So firstly I will tell you all which all skills are included in this 15 skills, and then you may get any 4 from that. First skill station is administration of inhaled medication. So what we are doing in our day-to-day practice, like we are teaching patient how to take the puff for asthma. It's same station, but we have to teach the patient how to take the puff. Then we have to see whether the patient is taking it in a correct way or not. For all the procedure, for this procedure, you will get 12 minutes in total to complete the patient teaching and to see whether the patient understand or not. So this is all about the first skill, that is administration of inhaled medication. Then the second skill is blood glucose monitoring. सो ये तो ऐसे स्किल है जो हम सभी ने किए हैं अपने नर्सिंग पीरियड में, एटलीस्ट वन. आई नो सम पीपल आर डूइंग इट एवरी डे. सो वही स्किल आपको करना है. आपको बेसिकली एक लैंसेट रहता है, उससे पेशेंट को प्रिक करके ग्लूकोमीटर से आपको पेशेंट का ब्लड शुगर चेक करना है. तो वही आपको एग्ज़ाम में करना है और उसके लिए आपको मिलेगा टोटल 8 मिनट का टाइम. सो 8 मिनट में आपको ब्लड ग्लूकोज मॉनिटरिंग का प्रोसीजर कंप्लीट करना है. देन द थर्ड स्किल इज इट्स CSU, कैथेटर स्पेसिमेन ऑफ यूरिन. दिस इज ऑल्सो फॉर 10 मिनट. इसमें आपको क्या करना है, पेशेंट को यूरिनरी कैथेटर ऑलरेडी रहेगा, आपको कैथेटर से यूरिन स्पेसिमेन कलेक्ट करना है. अभी वो कैसे कलेक्ट करना है, देयर विल बी वन सेपरेट पोर्ट, वहाँ से आपको कलेक्ट करना रहता है ये यूरिन. कैसे कलेक्ट करना है एंड हाउ टू डू इट क्विकली, उसके लिए क्या स्टेप्स है, दिस एवरीथिंग आई विल एक्सप्लेन इन दैट पर्टिकुलर वीडियो. ओके, सो द नेक्स्ट, और मैंने ऑलरेडी मेंशन किया कि दिस इज ऑल्सो फॉर 8 मिनट स्टेशन. सो द नेक्स्ट स्किल है नेज़ोगैस्ट्रिक ट्यूब इंसर्शन. तो ये भी एक स्किल है OSCE में, और ये स्किल करने के लिए आपको टोटल 12 मिनट्स मिलता है फॉर OSCE एग्ज़ाम. तो यहाँ पे भी आपको पेशेंट का फर्स्ट मेजरमेंट लेना है फॉर टिप ऑफ द नोज टू ईयर लोब एंड फ्रॉम ईयर लोब टू सिपिस्टर्नम. प्रॉपर मेजर करके आपको बाद में एंजियो ट्यूब इंसर्ट करना है. तो ये प्रोसीजर करने के लिए आपको 12 मिनट्स मिलेगा. देन द नेक्स्ट स्टेशन है फ्लूइड बैलेंस इज अ 12 मिनट स्टेशन. I know all the nurses are doing it every day in all the shift. We have to calculate the intake output chart. तो सेम आपको एक फॉर्मेट रहेगा, उसमें ऑलरेडी पेशेंट का डिटेल एंड इन्फॉर्मेशन लिखा होगा कि पेशेंट ने कौन से टाइम पे कितना लिक्विड कंज्यूम किया है और यूरिन आउटपुट कितना है. यू जस्ट हैव टू फिल वन पेपर, intake output पेपर, एंड यू हैव टू कैलकुलेट द फाइनल अमाउंट. और आपको ये भी फाइंड आउट करना है कि ये पॉजिटिव बैलेंस है कि नेगेटिव बैलेंस है, और नीचे आपको साइन करना है. दिस इज़ ऑल अबाउट द फ्लूइड बैलेंस स्टेशन, और ये इसके लिए भी आपको 12 मिनट मिलेगा. सो मूविंग टूवर्ड्स द फिफ्थ स्किल, दैट इज़ इन हॉस्पिटल रिससिटेशन. यस, तो आपको CPR देना है ये स्किल में. आई नो इट्स लिटिल, एंड इसके लिए आपको सिर्फ 6 मिनट है. यू हैव टू बी वेरी वेरी क्विक. आपको बेसिक जो है वो फॉलो करना है. आपको पेशेंट का एयरवे, ब्रीदिंग, सर्कुलेशन चेक करना है. उसके बाद आपको CPR स्टार्ट करना है. यू हैव टू, बिफोर स्टार्टिंग विद CPR यू नीड टू कॉल फॉर हेल्प. सो मेनी थिंग्स यू हैव टू डू इन 6 मिनट. सो यू हैव टू प्रैक्टिस मोर अबाउट द स्टेशन, बट डोंट वरी, इट्स ईजी. और इसके लिए भी आपको 6 मिनट मिलेगा. सो मूविंग टूवर्ड्स द नेक्स्ट स्किल, दैट इज स्किल 7. दैट इज़ IM, इंट्रामस्कुलर इंजेक्शन. यस, आपको IM इंजेक्शन देना है. सो यू मस्ट बी थिंकिंग दिस NG ट्यूब और CPR, आर वी गोइंग टू गिव ऑन द रियल पेशेंट? सो नो, देयर विल बी नो रियल पेशेंट. वहाँ पे मोस्टली डमी रहेगा, तो आपको डमी मैनिकिन के ऊपर ही ये प्रोसीजर करना है. इवन फॉर IM इंजेक्शन देयर विल बी ओनली डमी, और समटाइम्स you will get only hand, so you have to inject the drug in the deltoid muscle. So this is all about IM injection. IM के लिए भी आपको again 12 minutes मिलेगा. आप and 12 minute is sufficient for IM injection, so you can do that. So IM injection तो आप सभी को पता है, but there are some steps that we need to follow for the OSCE exam and for the entire life when we are working in NHS. So we'll learn about that in further videos. IV flush and VIP score. I don't know how many of you doing VIP scoring in everyday life. VIP is actually visual infusion phlebitis. अगर आपको पता नहीं है तो you can search on Google. VIP स्कोरिंग जो है बेसिकली ये स्कोर यूज़ करके हम लोग IV कैन्यूला चेक करते हैं कि वो कैन्यूला अच्छा है कि नहीं. हाउ इज़ द कैन्यूला साइड, इज़ इट रेड, इज़ देयर एनी स्वेलिंग, is it tender, is there any palpable venous cord, और dressing is intact or not, और पेटेंट है कि नहीं, ये सब चेक करने के लिए वी आर यूजिंग VIP स्कोर. तो यही करना है आपको ये स्किल में. सबसे पहले आपको IV कैन्यूला चेक करना है बाय यूजिंग VIP स्कोर, और उसके बाद आपको पेटेंट है कि नहीं वो चेक करना है बाय गिविंग सलाइन फ्लश, 10 ml सलाइन फ्लश. तो ये कंप्लीट प्रोसीजर के लिए आपको टोटल 8 मिनट का टाइम है. सो 8 मिनट में आपको ये प्रोसीजर कंप्लीट करना है. देन मूविंग टूवर्ड्स द नेक्स्ट स्टेशन, दैट इज़ pain assessment. Yes, so in this pain assessment station there are few points that is very important to remember, like points are, there are shortcuts to remember this station, like what you are actually going to do in this station, like PQRST, like what start the pain, pre means provoke, means what caused the pain, and what feels you better, what makes you feel worst, like that. Q means quality, like how it feels to you, either it is stabbing pain, throbbing pain, crushing, burning. There are different dull pain, sharp pain, so many types are there. You need to ask to understand more about the pain. You have the 6 minute. 6 मिनट में आपको पूरा प्रॉपरली असेस करना है कि आपको पेशेंट को कहाँ पे पेन है, वो कब से है, उसका रीज़न क्या है, व्हाट मेक्स पेशेंट फील बेटर. तो एंड यू हैव टू मेक पेशेंट कंफर्टेबल, आस्क देम टू इफ दे नीड एनी एनाल्जेसिया. सो दिस एवरीथिंग इंक्लूड इन दिस स्टेशन, एंड यू हैव 6 minutes टू परफॉर्म दिस स्किल्स. सो मूविंग टूवर्ड द नेक्स्ट स्किल, दैट इज peak flow rate. Peak flow is actually, this is not something we are doing in everyday life. Maybe आप में से बहुत जन ने ये पहली बार सुना होगा कि what is peak flow rate. So peak flow is like we have one instrument called peak flow meter. वो use करके we are going to check the patient lung capacity. पेशेंट का टोटल लंग कैपेसिटी कितना, ये चेक करने के लिए पीक फ्लो मीटर यूज़ करते हैं. सो आई विल टेल यू डिटेल इन द नेक्स्ट वीडियोज़. सो ये चेक करने के लिए आपको टोटल 8 मिनट का टाइम है, एंड आई रियली फील दिस इज़ नॉट सफिशिएंट, क्योंकि आपको पेशेंट का 3 रीडिंग लेना है. उसके पहले आपको पेशेंट को एक्सप्लेन भी करना है कि हाउ टू टेक द पीक फ्लो रीडिंग. सो यू हैव टू बी वेरी वेरी क्विक इन दिस स्टेशन. Pressure ulcer assessment, it means Braden scale. Braden scale, I think we all know. Braden scale is the tool to assess the pressure ulcer. Like आपको एक सिनारियो दिया रहेगा, in that all the details will be there. वो रीड करके आपको Braden scale में फील करना है, and then you have to calculate the final amount, like total number, and then you can know that how much your patient is risk for developing the patient ulcer. और उसी के लिए आपको टोटल टाइम मिलेगा 8 मिनट. विद इन 8 मिनट यू हैव टू रीड द सिनारियो, अंडरस्टैंड द सिनारियो, फील द Braden scale, and calculate the result. Removal of urinary catheter. So catheter removal करना है आपको. Before that you have to make sure that urine bag is empty. These are the few tips I am telling in between. And then you have to take out the catheter. उसके पहले आपको ये भी देखना है कि उसमें कितना बलून में कितना वाटर इन्फ्लेट किया है to fix the catheter. So many other things are there. So catheter removal के लिए आपको टाइम मिलेगा 8 मिनट का. So you can do that in 8 minutes, no worries. Then moving towards the next station, that is subcutaneous injection. So subcutaneous, like insulin, how we are giving to the patient, same. They may ask you to give the insulin to the patient. There are few procedures we need to follow. Apart from that, everything is same. And for subcutaneous injection, again we are getting 12 minutes like IM. So IM and subcutaneous injection both for 12 minutes. Then the next scale is mid-stream urine analysis, and this is really difficult because they will give you one sample, looks like urine. You have to dip the urine analysis strip and find out the color. If you do any mistake in to understand the correct color within the correct time, then it's a fail. So this is very tricky station, I feel. So don't worry. With practice we can do that. So mid-stream urine analysis is for 8 minutes. So before, you have to tell the patient how to collect the urine, then you have to do the urine analysis test, and you have to explain the result to the patient, everything in just 8 minutes. Okay, so the last skill, that is wound assessment and ANTT tracing. Like, these all two different stations, but sometimes they may ask you to do it in a combined way. Like, first you have to do the wound assessment, and then you have to do the wound dressing by using aseptic non-touch technique method. Okay, so this is like, you have to be very, very careful that you are not contaminating any part, you are not contaminating any dressing material. So this I feel a bit difficult, but with practice we can again do that with the practice, no worries. So for this station combine, you are getting 21 minutes if you are doing it combined. If not combined, means for wound assessment you will get 6 minutes, and remaining 15 minutes for ANTT wound dressing. So this is all about the OSCE skills, and out of this all skills you will be getting only 4 skills. So I hope you understand. First 4 stations will be assessment, planning, implementation and evaluation. Next 4 skills will be out of these 15 skills. And now it's total of 8, correct? We finish with the 8 station, now remaining 2 stations. So remaining 2 stations are silent writing stations. In that you have 2 headings. First is professional value, and the second station is evidence-based practice. So in professional values, again you got 5 different types of professional values. So first we'll see the professional value, that is 9 station, and what all things inside the professional value. So in professional value we got 5 more different topics to cover, and out of these 5 topics you will get only 1 topic to write in your exam. So we really have to thorough with all the topic. That is very, very important, because sometimes there are chances to fail in this topic if we miss one important point. There is assessment criteria for all the OSCE skills and stations, so we need to stick to the assessment criteria, and if you are following the assessment criteria properly, nobody can fail us. So don't worry, we'll see that thing one by one. So I will tell you about the professional value. It contains first confidentiality. Confidentiality means we need to, in any case, we need to mention the patient confidentiality. Now you will get one scenario and you have to write in that scenario what you will do to maintain the patient confidentiality. Then and one more thing, this professional value station you will get 10 minutes For this station you will get one scenario and you have to elaborate that what you will do in that scenario, and you have only 10 minutes for reading and writing. Okay, so first I said confidentiality. Second one is professional confrontation, means if anything happen, it's not about if something patient is for procedure and it got delay and patient is very angry on you, then what you will do in that situation. This is about professional confrontation. Then the next is possible abuse. Yeah, possible abuse is all about safeguarding. If you saw somebody is abusing your patient or somebody is abusing you or your colleague, so what you will do, what stand you will take in that situation, you have to write in possible abuse. Then the fourth one is drug error. For example, in our day-to-day life, if we done any drug error, like by mistakenly we administer or we gave different medicine to the patient, or we gave the more dose or less dose or wrong dose to the patient, then in that situation what is our responsibility is all about the drug error. So we need to write everything what we can do in this situations. Okay, so don't worry about this, I'm gonna share you with all the notes, how to elaborate the points and how you can write this station. So it is gonna be easy for you all. So the next and last is use of social media. Use of social media means it's again like confidentiality of the patient. If somebody is sharing patient information on social media without patient permission, then what you will do in that case? If your colleague took some pictures of your patient or your notes, photos of patient notes and sharing to somebody else, and you realize that, then what you will do? This is all about use of social media topic. So these 5 topics are under professional values, and you will get 10 minutes to read and write, read the scenario and write what you will do in that scenario. So moving towards the last station of OSCE, that is evidence-based practice. Evidence-based practice is what? In this station, we all will get one scenario and some research, 3-4 research topic under that scenario. And what we have to do, we have to read everything, all the research topic, and from that we need to select one answer. Like there will be scenario like patient is asking, if I am not on insulin but I am diabetic, there are how much chances that I will get hypoglycemia. And there are so many scenarios down, like research studies which shows the different points about hypoglycemia. So what we have to do is we have to read all the research topic, वो पूरा read करके हमें उसमें से selected point pick करके लिखना है as our answer, what we are going to tell to the patient. Okay, so this is all about evidence-based practice. Again, this is all about evidence-based practice, and again we'll get 10 minutes to complete this station. इसमें भी same like professional values. We are having 5 topics. Out of these 5 topics, we have to write any one topic which they ask us to write. So I will discuss all the 5 topics one by one. So first is use of honey dressing for venous leg ulcer. So in this topic you will get some research material. By reading all these things, you have to write your opinion about the use of honey dressing for the venous leg ulcer. Then the second topic is smoking cessation. In smoking cessation, what you can advise your patient if he wants to quit smoking, you have to find out from the research and you have to make an answer. Then the third is use of foam dressing for prevention of pressure ulcer. Same like other topics, you have to read all the articles and catch the possible and most adequate information and write it down. Then the fourth is hypoglycemia. What if patient asks you any question about hypoglycemia? Again, you have to read the research topic and elaborate your answer. The last is female myocardiac infarction. So in female MI, you have to again find out from the research and you have to write some topics related to this female MI. Okay, so all this is for 10 minutes and you have to write only one professional values and one evidence practice, whatever they ask you for exam. Okay, So I hope you understand the basic about OSCE. This is just the small information like overview about the OSCE, like what is OSCE और उसमें कौन से stations है, इसके लिए ये just basic informative video था. But next video onwards I will try to cover all the individual topic in details. If you have any doubts in between, you can definitely message me on my Instagram ID, or you can comment down below in the comment box. I will surely try to help you out. So I hope you like this video. If you like, please don't forget to like, share and subscribe to my channel to watch new videos related to this topic. So thank you so much for watching this video. So stay happy, stay safe, and bye bye.